joining us. Thank you those at our other sites. I appreciate. I have a little TV monitor. I can see everyone, ignoring me. Listening carefully up there. See, I see all of them there. So thank you all. I'm John Lewin. When you get to 15 months, almost 15 months, people stop introducing you. So I figure either you know who I am or you don't. And if you and you chose to come knowing who I am. So I appreciate it. Seeing all of you is great. It's a pleasure to be here to do another update on us. And what I'd like to do is really look at a couple things, in large part looking at the environment, looking at what we're dealing with in our environment, looking at how we're addressing that environment, and looking at some of the progress we've made during the last year. And some of you have heard me say this before, but what I've done is I've tried to really break the work of the last 14, 15 months down into sort of big buckets. There are literally probably 1 million little detailed issues that come across my desk. And I realized if I treated each one equally, I would never get anything done. So I've tried to really kind of group the issues into sort of 3 big buckets that have been my priorities over that time. And the first is working towards strategic clarity. We'll talk a little bit about strategy, and that's most of what we'll talk about today. It's the idea of, do we know where we're going? Do we have a clear vision as an organization of where we are going? And the second part I've been working on is what I'm calling effective architecture, is to make sure that we not only do we know where we're going, but we have the organizational structure, we have the processes, we have the committees in place to actually give us a chance of getting there, right? You need to have a good engine to make forward motion. So working on some of the little bit of redesign, some pretty significant changes in sort of committee scope and decision-making processes has been an important part of the work, in particular over the last 6 months or so. And then the last piece is, I want to make sure that as we have the engine to get us to that point on the horizon where we're going, that we get there in the right way. It's not just enough to get somewhere. You want to make sure you've done the right thing along the way. And if possible, you want to make sure that there's joy of work for everyone in getting there. And that's part of the work at taking what's already many aspects of good culture here in the organization and seeing what can we do to actually make that even better. So I'd like to start with just a minute on what is strategic clarity. And there's a lot of ways to think about strategy. And there's a sort of famous business professor, Michael Porter, up at Harvard Business School, who really wrote one of the seminal papers on what is strategy, and at this point a few decades ago, but it still has sort of held up as the fundamental concepts of what's strategy. So it's easy to think, well, strategy is knowing where you're going. Well, as you decide where you're going, what's important in doing that? And there are 3 things that he described. One is you want to make sure that you build upon the unique position. You want to make sure that your strategy highlights those things that you do better than anyone else. And we're fortunate as an academic health system, as really the only comprehensive academic health system in the state. There are a lot of things that we do really well that others don't. So we have to make sure as we design our strategy, we don't say, okay, we're going to figure out how to compete with a WellStar by being just like a WellStar. What we need to do is to say, what are those things where we do it better, we do it smarter, and build on that. The hardest part, in my experience in strategy, is understanding that every time you say yes to something, you're saying no to something else. So the idea is you want to say no intentionally. You want to understand your trade-offs. So if you say, again, a lot of us run into this problem in our own lives, you say yes to everything, you can't do everything. There aren't the resources, there's not the time, there's not the dollars. And so we need to decide what are those things that we're going to invest in and what are those things that may be very important. We're not going to ignore them, but they're not going to be the core of our investment. And that's a difficult thing, and it's something that we need to do, and we've been working toward. And then the last part is that you really want the whole to be more than the sum of the parts. You want to fit. When you decide to do something, you want to say, yeah, this is good on its own, but it also makes this part of what we're doing better. Or it also brings patients in to this part where we really want to bring people in, whatever, or helps us recruit this type of person that we've been having trouble with if we do this. So you want to make sure that you have a good fit between the activities as well. And using these, We want to sort of figure out where are we going, how are we moving there. Well, before we get to some of where we're going, let's talk a little bit about the year in review. And obviously, you all see probably pretty much every day, unless you come in through the back, the new university tower, the hospital tower. Again, we gotten rid of the name, the J-Wing. This is the EUH tower, the hospital tower. And it's just beautiful. It's coming up. I congratulate Bryce. I congratulate the team here who worked on planning it, on executing it, on managing the building of it. As you know, it's going to start opening up in late July, finish up by October, and it'll be transformational. 232 beds, state-of-the-art facilities. It's going to be just a fantastic facility. You also see what's happening over on Clifton Road, and it's just wonderful to watch now that it's paved, and the center areas are being done and getting sidewalks put in. It's going to really be something that'll be enjoyable. Again, I wish I could do something about the traffic on it. It's a different story. Maybe everyone will get used to taking MARTA, and we'll get our MARTA here quicker than we expect. But at any rate, it is really going to be beautiful, and it's moving forward as well. In terms of, again, the tripartite mission, what is it that we do that we can take advantage of at Emory that our competitors, our local competitors can't? It's the research that we're doing. And if you look at Emory University, it was, again, 7th year in a row, it's been over $500 million in research, external research funding. This year it's a new record. It was $575 million of external funding coming in 2016 towards research. And that's allowed us to do a lot of things in clinical research where we get things here into the hospital, and in particular EUH, which is the seat of much of that research, but our other hospitals as well take part in the clinical research that we're doing. And what's really important is that the research that's going on in the medical school, at School of Public Health, in the nursing school, Yerkes, the Cancer Center, these are all directly impacting patients in a great way. So it's not just the care we're doing here in clinical trials in Winship or clinical trials in heart and vascular, clinical trials in transplant, but it's also the fact that we're able to take those trials, take the results, and change the way people are treating patients around the world with those. We've been spending time on the value acceleration projects. We got 22 of them we got 16 of them that are going on right now. About half of those are in clinical areas where we're working on improving quality, improving the workflow, and taking cost out. The other half are more in the processy side of what we're doing, a couple in the ORs, the others sort of more in back offices where we're, again, working to become more efficient. And this year we're scheduled to get around $22 million in savings from those. And that becomes really important. These types of quality improvement, process improvement projects, really, if you do them right, are wins for everyone, because the quality should go up. If you do them right, you're improving quality. If you do them right and get waste out of a system by getting rid of steps that don't really add value in a meaningful and disciplined way, well, it's better for us as providers because you don't waste the time doing things that you always wondered, why is it I'm filling out this form? Well, who really cares? If you get rid of those kinds of things, it makes our lives better as providers. And the bottom line is, if you get rid of wasted time and wasted effort, you decrease the cost in a smart way. So it really is win-win-win. So for all of you who have been working with these VAP projects, really appreciate it because it makes a real difference. How many of you all have heard of the Cox Kennedy Gift? You know about that? So about half of the people here. So Mr. Jim Kennedy, who's the chairman of Cox Communications, he was a patient up at St. Joe's, and it's public knowledge, it's not HIPAA, not hurting anything by saying that. And he was very grateful for his care there. But what he noticed was, wow, if I ran my company, which is Service Cable Communications, if I ran my company the way that I see, you guys are running healthcare, I'd be out of business. Because people wouldn't be happy getting, the bill, you get the cable bill, and it says one thing, and then you get another form 2 days later that says, well, no, maybe we meant something else, right? And then you get another form explanation of, so it's really, he felt that there were some real gaps in service, in particular in communication, in access. And he said, you know what, I'd like to see you really improve that. My care was great, my outcome was great, the doctors were fantastic, the nurses were fantastic, but everything was so burdensome. I'd like to see it if you can do it better. So he said, here's $25 million over 5 years, and a couple things he wanted to do with it. One was he gave a couple of professorships to the 2 doctors who primarily took care of them, which is absolutely wonderful. But then he also said, okay, the rest of it, what I'd like to do is have you look at making things better. So a number of people, Bill Borenstein and Chris Larson, are leading the work in process improvement, figuring out how do we improve scheduling so it's easier for patients, how do we improve communication so that the referring doctors hear back more efficiently, how do we improve flow, just really looking at process improvement. We brought on a fantastic recruit, Victoria Jordan. I don't see her here today. Her office is here in this hospital. She's a system person in quality improvement. She's an expert in lean. We got her from MD Anderson. We're looking at how do we, starting with urology, starting with St. Joe's, but then really taking what we learn and moving it across the system. How do we become more efficient moving forward? So an incredibly impactful gift that we're very excited about. Some of you will probably know that we have a deal with the Hawks. We made sort of early in my tenure last year. I was actually driving down to move to Georgia with the dog in the back seat and all our stuff piled high on the phone trying to help negotiate the executive park purchase. So it was kind of a fun timing for me. And we succeeded in doing that, and we succeeded in bringing the Hawks in, and the Hawks practice facility is being built in Executive Park, and it's going to have a 35,000 square foot sports medicine facility in the same building. And at least in theory, they said, and we'll see if it really happens, that you'd be able to sit in a waiting room and overlook the practice court. I'll believe that when I see it. But it was a great concept when it was talked about. So we're very excited. We're the official team healthcare provider. So not just the team sports, but the overall team healthcare provider for the Hawks. Just recently we announced that we also have that recognition with the Braves, where we, as of about a month ago or so, 2 months ago, are the team healthcare provider for the Braves. So we're out there and taking care of the players. We have a sign. It's a rotating sign, so I actually have no idea how often it's out there, but it should be, I don't know if it's a third of the time or a quarter of the time. Emory Healthcare right behind the batter from the camera angle. So if you're watching it on TV, it'll be really highlighted out there. So we're very excited about that. And we've been taking care of the Falcons as their primary team doctors for a while. We went with them to the Super Bowl. That wasn't quite enough to get us over the end, but we were not giving any hints on strategy during the game. So that you cannot blame on us. But we're very, again, and these things are important because one of the things my hope is that we as Emory Healthcare can increase our brand recognition so people in the community realize that it's not just, a local community hospital that's extremely good. It's that we do things that really others don't. And our sports medicine is one way we get that out there in a very visible way to many people. Rankings are something that everyone says aren't important unless you're not ranked, right? And then that becomes very important. And we're very happy that we've had some really great recognition from national ranking. And everyone hates U.S. News and World Report, but then they all have to look immediately to see where they are on it, right? And our physician's assistant program is ranked number 3 in the country. Again, maybe a little known, hidden gem. Nursing moved up to number 4 in the country. Great. It was number 8 last year. I think it's up to number 4. Physical therapy is a great program. Again, another hidden gem here, one of the best in the world. And again, this year ranked number 5. Public health, the School of Public Health is ranked number 7 in the country. The nurse practitioner program, number 8. The medical school, and number 23. Again, we've slowly been inching up in our research funding, which then brings up that ranking over time. The transplant program is really exciting. Being number 1 in Georgia, I'd be kind of disappointed if we weren't number 1 in Georgia. But being number 2 in the country for outcomes is really remarkable, and my hat's off to actually does deserve some applause. And you know what's great about that? I mean, having outcomes as the gold standard for what we do is really doing the right thing by our patients, right? That's really where we want to be. And transplant's a great example because it takes a village, right? It takes a great surgeon, but it takes a great OR team, it takes great nursing, it takes the respiratory therapist, it takes every part of our organization working together to have these kinds of outcomes. It takes the environmental service person who's cleaning the OR to do their job well, to do this. So it's really something where the whole team is critical. So I was very proud of that. The Transplant Center also did Georgia's first kidney transplant from an HIV-positive donor to an HIV-positive recipient, which is really important because as you're looking for organs, again, there are willing donors who are HIV-positive and can't be used. Up till now, those organs could not be used. Well, if you have someone who's HIV-positive who's already going to be on lifelong HIV suppression medication, there's no reason not to. It can save a life, with those organs. So it's really exciting to have done that as well. Emory University has worked hard on diversity and inclusion and partnering with, across Emory Healthcare and Emory University, working in that regard has been an important action and event here at EUH. Financially, again, we are a mission-based organization. That means we really want to give great care to patients. We want to make discoveries. We want to educate the future generations. We want to have a social impact in what we do. We want to have joy at work so the providers get, feel the impact of what they're doing. But the bottom line is we can't do any of that if we're not solid, if we're not having good finances. What's really nice to see is this year's been a fantastic year in terms of finance. Just got the end of March numbers, and we are having by far the best year we've ever had as an organization. And the only way we do that is by everyone really working hard to make sure there's not waste, to make sure we're working smart, to make sure everyone's working hard, and we're doing it. And what's nice about that, again, so finances, you think, well, that's great, someone's going to make a lot of money. Well, we're not a for-profit